Hello everyone, today we are going to talk about tuberculosis. First of all, we are going to discuss its definition, then the clinical features, etiology, pathophysiology, treatment, and diagnosis. First of all, the definition of tuberculosis. TB or tuberculosis is a communicable disease which can be spread from man to man. It is a chronic granulomatosis. The species which caused the TB is known as Mycobacterium tuberculosis. It is a bacterial species which causes the TB, Mycobacterium tuberculosis. Mostly the lungs are infected in this disease, but the more the serious the condition is, it may affect any organ or any tissue of the body. Mostly lungs are infected. Other body parts can also be infected. Okay. Now coming towards the etiology of tuberculosis. There are three types of bacterial species which could cause the TB. It's Mycobacterium tuberculosis, which is like 90 to 95% of cases are caused by Mycobacterium tuberculosis. The causative agent is Mycobacterium tuberculosis. Up to some extent, another agents are also involved. Okay, the another agents are Mycobacterium bovis and Mycobacterium africanum. 2% prevalence rate is of Mycobacterium bovis, which are present in cattle, and it can also cause TB. And the Mycobacterium africanum is negligible. Okay. After it, we are going to talk about the pathophysiology of TB or tuberculosis. Simply, the Mycobacterium tuberculosis or its species entered the body by an initiation in the alveoli. The infected person coughs or sneezes, due to which a droplet is formed in which Mycobacterium tuberculosis is present, and it enters into someone other's alveoli, where it escapes the epithelial cells of the lungs and it is engulfed by the macrophages, where it multiplies in number. The place where the droplet nuclei is formed, this is the place where infection occurs, where tissue necrosis occurs, and it is also known as Combs complex. The incubation period for this bacteria is 2 to 10 weeks, after which the signs and symptoms of the TB could be seen, and the latent infection may persist for the lifetime, like if you do the therapy or treatment of the TB, but the latent infection, like the infection present in body, the bacteria could be turned off, but they would be present in the body for the lifetime. Okay. Route of transmission is lungs or air. The routes of transmission is lungs, as I told you, by coughing or sneezing. Okay. Mechanism of transmission or causing the tuberculosis: simply when the tubercular bacilli are inhaled, they reaches the alveoli, where they are engulfed by macrophages and are destroyed. If not destroyed, they further replicate into the few weeks, and the threshold level is achieved within 2 to 10 weeks. And after this, it may be accompanied spreading in the blood or lymphatic system. Okay. As these are spreaded into the blood and the lymphatic system, the whole immune system becomes active, and there is a condition of fight in between the body and the foreign particles, and due to which infection is caused. The infection is mainly in lungs, but it can affect bones, intestine, pericardium, lymph nodes, kidneys, and other body parts. Okay. Now moving towards the next topic, which are the clinical features of TB or tuberculosis. No specific symptoms are achieved or it can be seen, but there is common symptoms which are cough, night sweats, dyspnea, fatigue, fever, malaise, anorexia, weight loss, wheezing, etc. Okay, there are no proper clinical features by which we can tell that or which by which we can diagnose that it's a patient of a tuberculosis. Diagnostics are done using different conditions. First we are going to talk about the diagnosis, then we will go towards the treatment. I missed that topic. Diagnoses are done by using a chest x-ray, radiography or microbiology. X-ray is done, microbiology, PCR technique may also be used, PCR technique, and there is also a tuberculin reaction in the form of Mentos and Heave test. Okay, a test or blood test could be done to know about the diagnosis. After the diagnosis, when the patient has said that he or she is having TB, so we would come towards the treatment. The treatment protocol of TB is there are some anti-tubercular drugs which can kill the bacteria or which can make the bacteria turn off. These are there are two type of drugs, which are first line anti-TB drugs and the second line anti-TB drugs. The first line are isoniazid, which is hydrate of isonicotinic acid, rifampicin, which is a macrolide or aminoglycoside, I guess, pyrazinamide, ethambutol, streptomycin, etc. Okay, these are the first line anti-TB drugs which are given for a month of these are given for 2 months. Then there are second line of anti-tubercular drugs, or we can say that the continuation phase drugs, which are ofloxacin, ciprofloxacin, clarithromycin, azithromycin. Different type of antibiotics are given in this condition. Okay, mostly floxacin family and mycin family. Okay, now moving towards the side effects of anti-TBs. Because the therapy is for a period of 7 to 9 months, so obviously there would be certain side effects caused by the drugs, which could be there could be hepatitis or hepatic nephritis. Hepatitis like of condition mostly related to isoniazid. It could be neuropathy or fever or flu-like condition, hyperuricemia, nausea, flushing, anorexia. It's because it's a very long type of therapy, so obviously the side effects would be more prone. That was all for TB. Thank you so much for watching.